You know, you really need someone who understands what your day looks like, and also someone that you trust. Routine is really important in outreach, so even though it seems like our patients' lives are really chaotic, we need to be rock solid in routine so that they know when they don't have a phone or a calendar or a routine, they can remember in their head after a while, every Friday Jack's gonna be at this corner. And that's really important so that they don't need any tools.
I like going to MOSH because they treat you like a human being. They treat you with respect, like you should be treated. Yeah, the van comes around. They come around, usually come around twice a week. So I just go out and meet them and I get all the stuff that I need.
The population that we serve, they often arrive with previous experiences in healthcare that have not gone well for them. So there's almost always going to be a little bit of a barrier that you have to try and break through. So the MOSH van, the mobile unit, is almost literally a doctor's office on wheels. We are able to manage just about anything that comes our way. We're mostly seeing, wound care, blood work asks.
In 2016, I got my prescriber's license and was able to start prescribing for Hep C, and I would be able to go to them wherever they were at, in a tent, at shelter, whatever, do the blood work. I'd do a physical exam, get them lined up, and then we'd link into a pharmacy that they had a really good relationship with and start the drug right away.
I was in jail in 2013 when I found out I had Hep C. No, me and my boyfriend, actually, we did share. That's exactly what it probably came from. We weren't around a lot of supplies at the time, and that. Jack Atkinson, and she's my doc. I was able to get treated by Jack over at MOSH. I was getting them daily, for 3 months supply, and I had to take them every day. They delivered them to me right at my door. Actually, it was Mike. He just told me a week ago, doing all my blood work and that, and he just said, Kathy, your blood work all came back. He said, everything's good. He said, your Hep C's gone too. I said, oh, great.
When MOSH started out, we only had 12 hours of physician care a week. It was really a nurse-led model. And I think one of the greatest things about nurses is that they're real resource finders. And so nurses really understand the healthcare system and how to get around all of the burdensome barriers.
And so now, not only do we offer, the outreach van, but we also have a bricks and mortar clinic, and we actually are situated within the North End Community Health Center, where people can access most MOSH services here as well as on the outreach van. And so there's kind of two ways to find us.
I haven't had a doctor in years, and MOSH was nicely to offer me a doctor, Dr. Leah Genge. And ever since I've been sober, I've actually am taking control of my health again and my diabetes. So Dr. Genge helped me get through that struggle. It was a few years ago I got infected with Hep C, but Dr. Genge, she works with Hep C, and she got me in there to get me treatment again. Yeah, being free of Hep C would do a number for me. I got my own place now, and get that relationship back with my kids too. Overall, I just want my overall health back.
Being able to treat Hep C in the community is an overwhelmingly positive experience. And it also just invites more conversation for other needs we can meet.
Dr. Leah Genge is phenomenal. I love her as a person, and I have from 7 years ago. She's always been a phenomenal doctor. I tested positive for Hep C 3 years ago now, and now negative.
We are a family of people who care for the people in our community. There's no hierarchy here. It's team-based care. Most of our programs are nurse-led, and my role is kind of to support in whatever way possible.
Yeah, MOSH is great, and not just Dr. Leah, but all of them. Dr. Mike, he's awesome. Harold, all the MOSH teams, everybody that works, really, really hard behind the scenes. Like they come pick you up, take you for appointments, make sure you get there. Yeah, they're great. They're great. They go above and beyond. And
the positive outcome could be like not using 5 times a day that day, or only needing to use a few times compared to what you used to do. Or it could be even more tremendous things like employment or finding an apartment. Those outcomes are really valuable, and I think they really encourage people to continue to engage with us, and also it encourages us to keep fighting the fight and trying to help.
I think that was what was magic about MOSH, is that most of what we do is not medicine. It's about building relationships and navigating our complicated health care system, and nurses excel at that.